life. But we have a great relationship with our friends at the hospice, and we've done the hospice campaign here for, it's been 11 years. We've been doing the face-to-face for hospice. Windsor, Essex, 500 people going to 10 people they know asking for $10.
I think that's a great idea.
And we've been hit the mark every year, and we have surpassed our 50,000 this year, so it's been a great year. But you've had great news for our one and all. We love Carol Derbyshire here on our show, the Executive Director of the Hospice of Windsor, Essex. And why don't you share some of the good news that you've announced in our Leamington region?
Well, Leamington, we announced funding for a new hospice. You know, they approached us about the need for a hospice, and we said, well, listen, here's some planning funding. Go away and do a study to determine what the needs are. You know, what is the demand? And by the way, work with Carol and her team. They're a center of excellence. And they came back with a plan, and we took it to our board and we funded it starting 3 years out. And the reason for 3 years out is the foundation has to raise the funding to buy the land, build the building, et cetera, because what we fund is the bedside care. Now this is novel, and this is quite novel in Ontario. We've stepped up as our board and made a commitment 3 years from now to fund, I think it's $920,000 annually for a hospice. And you know as well as I do, people don't necessarily want to die in a hospital. They want to die in their home, and if they can't die in their home there's a number of reasons, they want to have a quality ending of their life in a hospice. You know, Carol tells you more about this when you talk to her. It's just such a good thing for a community. But it goes beyond the bricks and mortar. They do outbound counseling to families as well. So if you need assistance at a home to help a family member, they provide those support services with physicians, nurses, counselors, social workers to go to you. So it's not just the bricks and mortar. This is such a game changer for communities. We did the same in Chatham.
Oh,
Very same in Chatham. 3 years funding. Their funding will start in 3 years as well, because they need to go through a campaign to raise the funding. And they're working with a very strong partner in Chatham, St. Andrews, which is a long-term care and retirement home.
I mean, what they've got is the pain management, and I know with even counseling, one of the things we've learned about over the years of doing the hospice face-to-face was the work with children. Because sometimes it's the aunt, the uncle, the mums, the dads, the grandma and grandpas going through it, and they have a whole, I call it ministry to the children, just to have them understand of what's going on. So we are thrilled. I mean, she mentioned it, that there was some good news coming for the Leamington region. So thank you for doing that and seeing the vision. And really, our hospice, I mean, we're very local and homers, but they have really been a model, because I know a lot of people across North America have toured and have come in to see what's going on in this Windsor Essex hospice.
Yeah, it's I'd say it's a flagship. That's why I call it a center of excellence, and we have to leverage that center of excellence across our county.